Hi, my name is Dr. Duane Monteith, and I serve as Regional Chief of Thoracic Surgery in Baltimore for MedStar Health. I specialize in treatment of benign and malignant diseases of the chest, including lung cancer, esophageal cancer, and a wide range of benign conditions involving the chest. So when a patient comes to me with a diagnosis of lung cancer, I'm with them from the beginning through the process of working up and staging their lung cancer, through the treatment, and at least followed for 5 years after the treatment. When surgery is needed, I offer minimally invasive approaches to the treatment of lung cancer, including robotic surgery and VATS. It allows us to do the procedure through very small incisions, generally 3 incisions about a ½ inch each, and 1 more incision just large enough to get the nodule out. When I'm using this technology, the robot is at the bedside and the surgeon sits at a console and controls very precise and fine instruments that allows us to do these surgeries with a lot greater dexterity. The patient benefits from robotic surgery as they have less postoperative pain, a shorter hospital stay, and a quicker return to work. The incidence of lung cancer, unfortunately, is on the rise. We are seeing more cases daily and more cases being diagnosed. Smoking is the leading cause of lung cancer. However, we're seeing more and more patients, unfortunately, that are being diagnosed with lung cancer that have never smoked a day in their life. Nationally, 15% of lung cancers annually are diagnosed in non-smokers. These are related to genetic risk factors and environmental exposure. Here at the Angelo Center for Lung Diseases, we have a very comprehensive program. This includes programs including lung cancer screening and management and tracking of lung nodules, to a very dedicated multi-specialty team involving surgeons, oncologists, radiologists, and pulmonologists. We have a weekly multidisciplinary tumor board where we discuss all the cases involving new diagnoses of lung cancer or suspected diagnoses of lung cancer. And every specialty gets to weigh in and contribute in terms of what they feel is the best course of treatment. So we have a comprehensive lung cancer screening program that allows us to track patients that are high risk for lung cancer. And we also have the ability that if they have a positive finding, to diagnose them very early. When someone is diagnosed with lung cancer, usually the first thought is that this is a death sentence. However, with advancements in treatment over the past 20 years, lung cancer is curable and treatable. When lung cancer is caught early, the patient has the greatest chance of their cancer being cured. However, even in the later stages, there are many treatment options that can help improve the quality of life. I think MedStar Health is the best place for a patient to come, as they get very personalized attention and they get the best medical care. Lung cancer is scary. I want people to know here at MedStar Health, we have the best treatment options to help people fight and beat their disease.